So during my PD time, I performed an aesthetic surgery fellowship with one of our adjunct clinical professors, Dr. Josh Corman. So the goal was to increase my aesthetic surgical experience, my non-surgical injectables experience, and also understanding of the business of running a private practice. So we've had several residents through plastic surgery do clinical fellowships before, for example, at the Bunkie Clinic for interest in hand, and even we had a resident last year go to Taiwan for interest in microsurgery. So this was the first time we had developed something for aesthetics. So through a combination of the practice that I joined and through the university, so totaling together roughly the same as a PGY4 salary. So when we weren't operating, I was able to do my own non-surgical injectables clinic, which helped offset the cost of my salary through the practice, and then took some call at Stanford. So I was able to have some of my salary through them and keep my benefits, access to my email, PubMed, and things like that. So I knew I wanted my year to be clinical and busy and have operative experience. And in light of that, I also wasn't sure if I wanted to do aesthetics. It's hard to gain experience during residency to what a life in private practice might be like, and whether I would like the business side of things as part of my career. And so I thought this was probably the most effective way to help me decide if I could envision that path for myself in the long term. For one, my surgical skill is more advanced than it was when I started, given how much we've been operating during the year, particularly in cosmetic surgery, but also just finesse in general. And also I can frame what meetings I attend, what educational courses I attend, what attendings I visit around the country based on the narrowing of my interests that I've done throughout the year. And it's certainly helped with my career planning. And I still have about another year before I really have to decide, and then the world of fellowship applications comes along. And during our next clinical year, we do a lot of hand, we do a lot of micro, so I'm still open-minded, but I loved my year. I like being in the business side of things. I like having a hybrid of surgical and non-surgical and working with a team. So it was definitely something I could envision for myself. I'd say my first piece of advice is just to think outside of the box, and that just because someone hasn't done it before doesn't mean it isn't possible. It's a little daunting, but we have a lot of mentors at Stanford. For me, it was Dr. Young Nguyen and Dr. Josh Corman and Dr. Chang and Dr. Fox who really helped me put it together. So I think first figuring out your interests and what you want to spend the year getting to know more of, and then brainstorm from there for how to make it happen. I think another piece of my year that was really cool is beyond my operating and being in the business and being here, is that I also got to travel beyond. So I went to an aesthetic surgery meeting in New York City called Beauty Through Science in November. And then I went to the Aesthetic Society meeting and presented in Vancouver. Then I went and spent, between, around 7 days in South Korea. I went to Seoul with one of the other residents and spent 5 clinical days in 3 different very busy cosmetic surgery offices. So I think also having that international experience throughout the year was, really incredible.